This Wellness Couch podcast proudly brought to you by the Nourish Me Organics Gut Health Gurus podcast, hosted by food scientist Kribben Govender. If you're fascinated by all things gut health, the microbiome, fermented foods, mental health, mitochondrial health, and more, then search for the Nourish Me Organics Gut Health Gurus podcast on your favorite podcast app and get listening.
TheWellnessCouch.com, streaming wellness into your lives. This is Up for a Chat with Cindy O'Meara, Karen Smith, and Kim Morrison.
Here we are, up for a chat about the hottest topics that are important to you, inspiring you to awaken the change within. I'm Karen Smith.
And I'm Cindy O'Meara.
And guys, OMG, today's guest is really going to blow your socks off and blow your mind. We've got a woman who comes to us from the States today. So this beautiful woman is up, and it's 1:30 in the morning for her. So we are so grateful that she's been able to join us on the show today. But you know what? I actually think today's show is going to be a culmination of just about everything we've ever spoken about, but, you know, put into real life terms, because today we have the amazing Reina Weiner on the show. Now, if you haven't heard of Reina, you're about to, and you're about to discover everything that I guess we talk about, but you're going to hear it from a woman who is and has lived this actual philosophy that I guess Cindy, Kim, and myself talk about, where it's all about really being your own health advocate and really standing for, you know, asking questions, being curious, being educated, and being willing to do your own research. And lo and behold, here we have an amazing woman who has written her book on a subject that's so dear and near to our hearts. So listeners, listen up. If you're running, stop. If you're doing your groceries or if you're vacuuming, stop. You are absolutely going to want to hang off every word that we're about to share with you. Trust your doctor, but not that much. Be your own best healthcare advocate is the title of the book written by Reina Weiner. Guys, honestly, we are so grateful to have this woman on our show. Reina has gone through her own personal journey, but what really strikes me as amazing, and I can't wait to ask this question. Reina comes from a really professional background where she's worked as a former oncology representative, a national oncology trainer, a nursing instructor, and as now a patient in remission. So it strikes me as remarkably poignant that here comes a woman that's worked in that industry and then goes through her own personal journey and comes out the other side talking about her own experiences and having those difficult conversations. Reina, I'm going to stop because I think you're amazing. Thank you for being a part of the show. Welcome to Up for a Chat.
Yes, welcome.
Thank you. Thank you so much. Glad to be here with you.
Thank you for writing such a spectacular book, and we're going to get into the details of what you've written in your book. But I'm going to ask Kim's question, and then I'm going to throw it over to you, Cindy, because I know you've got a million questions to ask Reina. Reina, tell us about your own personal journey leading up to writing this book, because to me, it's incredibly curious that you would be in such an industry and you would have chosen such an industry and then to find yourself going down your own individual path. Tell us about how you got here.
Well, it was really serendipitous, I would have to say, that I started working in the pharmaceutical industry, initially as they call a flex time rep, and then got into oncology and worked as a representative for a pharmaceutical company, and then became the national oncology trainer, a nursing instructor, and then started having problems with my health. And the experience and some of the knowledge that I gained while working has really helped guide me and taught me that asking questions is really essential to your good health care and to your healing. And so I decided that my experience from both the professional and the personal would truly help, hopefully help another person who is going through it. And so I sat down and wrote the book. Took a little time, But I did have the time to reflect on what I thought would be useful. And so I did. I just put it out there, and I can see that there have been comments from people who have, I hope, been able to use some of the little tips and suggestions to make their way on their own healthcare journey, whatever their journey is, because everyone is different and everybody has the need to clarify with their physician or whatever healthcare professional they work with. So that is me, and that's the book.
Sounds absolutely wonderful, Reina. And I think so many times we do trust our doctor, but we trust them to the point where we just do everything that they tell us to do. And one of the things that I know I teach is that, if your doctor says, and this is just an example, if your doctor says, well, you have high cholesterol, go on these statin drugs, and stop eating butter and eat margarine. That was the usual thing that happened. And so I would then give a whole bunch of questions for people to ask that would challenge the doctor more often than not, because they didn't have those answers. So what I want to ask you is that when you were diagnosed with cancer, what were the questions that you asked your doctor?
That's a very good question. I did ask a lot about the illness. My very first question was when I knew that the disease was moving along, because for years I had a kind of a precursor to it. So I knew there was an abnormality, but at that point it wasn't cancer. But when I knew that it was getting closer to that actual diagnosis, my first question was, is there a clinical trial that would be appropriate for me? Because my job was to talk about clinical trials with physicians and nurses and pharmacists and just about anybody who would listen. I wanted to participate because I feel that research is the way to move medicine forward. So that was one of the first questions. And then, of course, in addition to the types of treatment that would be available, what would be my expectations as far as what I would experience with the treatment, more details about the disease that I wasn't already familiar with. But I do encourage people to try to do as much research as they can on their own to reliable sites, not just somebody saying this is what happened to me, but someone somewhere on the internet that you can get very valuable, helpful information. So I ask some questions about that. I get in touch, besides the doctor, with support groups, with foundations that would support me through the treatment, but also provide me with the information that I felt I needed in order to feel confident that I was moving in the right direction. So that's really where I started with the clinical trials research question.
I have a question around one of the first things that you said, and that was go to a reputable site. And the reason I have this question is that I'm having a little bit of a debate with a friend on climate change at the moment. And both of us have come up with some research from reputable journeys that are opposing. So the first one is from National Geographic, and it talks about the Antarctic, the Ross Ice Shelf not melting, and the other one is saying it is melting. So how do you do that? How do you decide? Is it National Geographic's or Science Today that I should be, or Science Daily that I should be looking at? Who's right and who's wrong? They're both opposing. They're both talking about the same ice shelf. They're both saying the exact opposite. So I'm someone who researches all the time, Reina, and I'm confused. I don't know which one to believe. So please tell us and the lay people that how do we find how do you know it's reputable anymore? It seems so much fake news out there.
Well, that's true, and it is very confusing for people, especially when it's a new diagnosis. you're very scared. A lot of times you're really not feeling well. And the combination of the responsibility to know what you're talking about and know which site to choose that will be information, like they used to say, news you can use, that same type of site. So what I have done when it comes to medicine is I would go to sites that like can say, for cancer, Memorial Sloan Kettering, I would go to WebMD, I would go to Johns Hopkins, the Cleveland Clinic, and foundations. So you can Google the foundation that pertains to your illness, not necessarily cancer, but it can be. So if you have a problem with diabetes, if you have a problem with skin disorder, and so many different disorders, there are support groups and foundations, and they will guide you. They will definitely give you more information that are clinically trial-related data. They will really connect you with the who's who, I should say. So I wouldn't rely, as you say, just on National Geographic versus the other journal. I would look at several. And when I see that the data is mounting with evidence that these are more informative sites, more reliable sites, more sites that you can trust, and I know there are several of them, then I know I'm likely moving in the right direction. And some of it is you trust yourself, too. What are you willing to do to get better? That's part of your healing as well, your own personal input and your own sense of what you choose, because there are choices. Everybody has.
I think I agree with you there. And Cindy's question, I think, is so spot on. There's so much information out there that, is based on people's opinion, and other information is based on pharmaceutical backgrounds, and others based on medical backgrounds, and other based on alternative health. And it's just, when somebody is newly diagnosed with something, there is a lot of fear. And you don't know where to go. That, I'm curious from your own perspective, Reina, how much of your own treatment decisions were based on, the information that you gleaned versus your own intuitive guidance in terms of what you felt was going to work best for you? Yeah.
Well, like I said, I started with a clinical trial search. And because I had worked in the industry, I was familiar with, in the United States, is the National Institute of Health, which is the biggest research institute in the world. And that is in Bethesda, Maryland. And then they have all these divisions, 27, I believe. And there's one that is devoted to cancer. So I knew that if I went there, that would be what I like to call the latest and the greatest. Not necessarily that you're going to find the cure or, the magic treatment, but you will find dedicated researchers who are going to offer you the option of trying something new that could work for you. And I looked at the data. I spent a lot of researchers who spend tons of time with you. So they will answer all your questions because they really are hoping that they will have people participate in the research and therefore hopefully find a new treatment that will then benefit many of the people who were diagnosed after you. So I just, like I said, I trusted the institution. I was glad to be part of the research and just knew it was the right place. But, you know as well as you can know. There are no guarantees. You learn that you get the information that you can, and then you step into it. That's the only thing I can say. You just have to trust somewhat. Trust yourself, trust some of the information, and learn to realize that you can make some educated choices and let it go at that.
And even just that approach of going straight to a research where they're doing medical research. I'm fascinated by that, obviously because of your experience. That was obviously your first choice. But, it's interesting. I wonder how many other people, when they're diagnosed with different illnesses, think to go to a research facility as their first port of call.
They don't.
No,
because they don't know. It's not that I'm so super duper smart. It's just that I worked in that field, so I became familiar with research. But if you go to the community physician, who I'm sure is competent, but they don't have the staff or the time to often get involved in research, then they don't tell the patient, and then the patient is usually pretty anxious, especially when it's a serious illness, that they want to get treatment, they want to get better, they want to go on with their life. So they go to whomever is recommended to them, sometimes by another physician, sometimes by a friend, and they start treatment with that physician, generally without the knowledge of research and clinical trials. That's why really one of the chapters in my book, Trust Your Doctor, but not that much, Your Own Best Healthcare Advocate, is all about clinical trials. And I do speak about trials to people who have already been treated. So it's advantageous if you get into a trial early on before you have any treatment, but then there are plenty of trials that would be available to you should you qualify, because there's lots of rules and regulations about them, that you can be a patient of when you have been treated with other treatments, drugs, medications, and so forth. But you're right. Most people really don't know anything about that. And, I wish that there were more opportunities for me to talk to people about it. But, you do everything that you can. And there are good treatments out there besides research. I just have like a personal bias because I think, like I said, they help you probably, and they have the opportunity to help other people who will be diagnosed after you, because when somebody has a serious illness and they go to the doctor, they want the best that's out there. And then if there's no research, then everybody gets the same product, that their friend, their mother, their grandmother had. And it's usually okay. But like I said, my sense is that research is the way to move forward, the way for medicine to move forward. So
I'm intrigued that you did do you went for a clinical trial because, and what you said was that you would help other people. So I just want to go back a little bit and ask you a question about your work in the pharmaceutical industry and that you were in oncology. So you would have known the best treatments for your disease, yet you went for a clinical trial for something new. Is that because you didn't see the results in what was happening for your disease? Or was there another reason why you went for clinical trial? Because I would have thought if something was working, why wouldn't you just go there? But if it's not working, then you want to look for something new. So what happened there, Reina?
Well, there are good treatments that are currently available to patients, but they're always seeking new information that will work even better than the current one. And as you know, I'm sure, when there are different phases of clinical trials, and the phase 3 is the trial that compares the current treatment that's available to the new one. And so it's just a way to say, is this new treatment any better, any more effective as far as progression-free survival in cancer I'm talking about, in overall survival, just general quality of life? Is this better, or is the current treatment better? And if this new treatment is better, well, then that offers people a new option to try. So it's not that I found out that the current treatment was not useful, helpful, and effective, but I thought, maybe there is something else. And there was, as a matter of fact, one of the current treatments, I had multiple myeloma, which is a blood cancer. The current treatment that was available at the time that I started treatment, which was 7 years ago, one of the side effects of the product was neuropathy. And people find that very uncomfortable, and it's sometimes disabling. And so I thought, is there some product out there that doesn't cause that side effect? And this product that I went on the first trial, because I've been on 4 trials already, that product did not cause the neuropathy. And I thought, well, that would be something that I would be interested in, because once you get the neuropathy, it usually stays with you. And if there's a way to avoid it with a medication that is just as effective, if not more, then why would I not want to try that? So that's what I did.
True. Could you explain to our listeners what neuropathy is?
Neuropathy is, neuro being nerve, apathy being disease, that the nerves are impacted. So people have a lot of times in their hands and feet. They can have it elsewhere, but that's often those 2 locations that are most common. And people have tingling. They have pain, in their fingers, in their toes, in their feet, in their hands. And it can affect the usefulness of those appendages. So it can be really, really uncomfortable, like I said, with tingling and pain and just general discomfort, really, really discomfort, depending sometimes on other factors. But and there are levels of it. Some people get it mild, and some people have more of a problem with it. So it's basically the nerve that has been disrupted and not functioning the way it should.
Interesting. So the new trial that you did and went on, what was different from the old? And was it a double-blind placebo? Did you know that whether you were going to get it or not? You got a different treatment, and did the people that were studying you know what treatment you were getting? So, I know probably being in your situation where you actually know about the treatment and you want a better one, can you opt to say, I want to trial the new one, or was it double-blind placebo?
It was not double-blind, and it wasn't placebo. In oncology, placebo is very, very, very rare because, it's ethically, when somebody has cancer, you want to hopefully treat them with the drug that will be most effective. And usually it's in oncology anyway, it's a couple of drugs, 2-3 drugs together. So there was no double blind. There was no placebo. This was like I said, I was in a phase 2 trial, would just be looking at, does this drug work? And it turned out it did. And then I wasn't in phase 3, which would be the next level, when they compare the standard of care, standard of care drug to the newer one. And no, people don't have a choice. And they are, in a trial like that, they are randomized, meaning randomly chosen to go on one arm of the trial or the other arm of the trial. And then I can say, though, too, that if one arm shows that it is much more effective than like trial A drug, not trial A, but arm A is more effective than arm B, and everybody on B gets switched over to A. So they don't, kind of stick you on one drug and say, well, it's not doing so well, too bad. That's not the way it's done. They will, at a point, see that there is a significant difference in either efficacy or side effects and such, and then move those people over. So, like I said, placebo trials in oncology is super duper duper rare, and they know exactly what you're getting and how much and when.
My sister and my mother both died of cancer. And they both chose no treatment.
Well, that's an option. That is an option. I really, initially, before I was working in oncology, didn't really understand that, why people would say, no, I'd rather not, have any chemotherapy treatment. But I did notice over time that people have the reasons to do what they do, and you learn to respect that. And so I have, and I understand that. And I hope when people make that choice that they have enough data to feel comfortable that this is the right path for them.
It's interesting. My sister was diagnosed with CREST at 25, which is an autoimmune disease with 5 diseases. And then at 40 was diagnosed with esophageal cancer, and which was part of the disease. And we did all the research, and she was not well. And so I ended up doing all the research, and I went to her and I said to her, these are your options. And one of them was an esophagectomy. And that came with complications. And so she chose to have a peg put in her body, and she fed herself for 12 months and was working on the Friday and died on the Monday. So in my way of thinking, she lived the best life she could. She went skiing. She still practiced as a chiropractor. She traveled and lectured that whole 12 months. But then the tumor got so big that she started bleeding, and she bled to death. So, I look at her choice, and, and even on her last day, I said, well, you can still have an esophagectomy, but the chances of survival are this. And I gave her the stats, and she said no extraordinary means. So, yeah, and my mum had lung cancer. So that was not a good treatment either. So, I would have loved to have seen your book. I think it would have been wonderful for them to read, to know their options, and understand, what was available to them. So
Sure.
let's talk about somebody who is facing that situation right now, who may be listening to us. Can you give us some steps that are in your book that they have no idea what a clinical trial is? They don't even know what their disease is. And I know you've given us websites and foundations and things, but do you have in your book exactly the steps that they take in order to reach a non-fear-based answer to what is happening to them?
Great question.
It is a great question. Well, I don't have steps per se that, you do A, B, C, and D. I don't really have that down. I mean, the book has, like I said, information about trials. That's one chapter. But the beginning, the book starts with, how do I find a doctor? How do I go about that? And that is really an essential step. Somebody that you feel really comfortable, somebody who is well aware that they are educators as well as healers, a physician, nurse practitioner, or PA who will listen to you and allow you to really make decisions along with them. So my big thing is talking about working in concert with your physician, learning what you can, ask. I must have said that 100 times in the book. Ask for what you need. Ask for more information. Ask for some guidance. Ask for support. And then continue, moving along in that direction. And then the second chapter is about preparing for a visit, writing down everything, all of the symptoms you're having. And this doesn't necessarily pertain to cancer. It could be any serious illness or newly diagnosed, a new problem that you're having. What symptoms are you having? What have you done to treat it? Are you having pain? Exactly where it is? How long you've had it? Is anything helping you to feel better? Do you have to take time off from work? Are you, just really a very clear picture of who you are and what you're dealing with. And then any other information that you might have. If you had any type of scans, an MRI, a CAT scan, if you've had some blood work, any data that you have that you can supply your healthcare professional with is all very valid information that they can use to help diagnose your problem. So finding the doctor, someone who will listen to you, making a list of all of your symptoms and what you have done and what you are willing to do to get better, and any, like I said, any scans, any research that you have that will help the doctor, or like I said, any healthcare professional to help you. And that's where you begin. That is really where you begin.
What do you think of all the alternatives that are out there? So there's Gerson, there's a whole series called The Truth About Cancer. There's Brzezinski and his anti-neoplastin, zeolite. I could go on, diet. What do you think about these alternatives that are out there?
Well, years ago, when I first started working in oncology, they used to say alternative and, use that term. And then as the years went by, they started to call them complementary treatments. And I like that term because I think that really it shows that it can be a very supportive therapy. So for me, my own personal take, and I'm not a physician, so I don't give medical advice, but my choice has been traditional medicine. But that being said, there are complementary treatments that can help, like, depending on, as long as it does not lessen the efficacy of the traditional medicine that you are choosing. So if you are using a chiropractor, it's fine. If you acupuncture, in addition to any supplements, all of those can be helpful, supportive ways to get you where you want to be. Mm-hmm. But to eliminate all the traditional medicine with an illness that's really, really serious, I personally, for me, that is not what I would choose. But like I said, everybody has to find the place that they are most comfortable, whatever it is. Mm-hmm. And so I would support their choice of, as long as they feel this is the right way forward for them, then yeah, that's okay.
I love your philosophy.
Thank you.
Yeah. Hmm. Before this book, you wrote another book on resilience. And I am sure that you would have needed a lot of resilience to go through what you've been through. Mm. Do you want to give us some, I know it's about children and resilience, but it must be for adults and resilience too. Do you want to give us some tips on how to be resilient?
That is a very good question. Well, I think the basis of both the first book, called Strong from the Start, Raising Confident, Resilient Kids, and the current one about Trust Your Doctor, but not that much, it's all about trusting yourself. Really is about trusting yourself as a parent when your kids are little and growing up, learning to trust them. And then when you have a challenge with your health, learning to trust yourself too, in addition to trusting the professional healthcare advice that you're getting. And, sometimes people think it's silly to say, but I really do think your attitude does get you through it. It really does. And there are times when it is very hard to be upbeat, when you're not feeling well, when you are dealing with some side effects, when you're wondering if this is the right treatment for you. And I just think you just have to reach really deep down and find what you can to keep you positive, to keep you motivated, to keep you exercising, to keep you eating properly, to keep me when things get a little tough. I make sure and I get my meditation in every day. And like I said, I exercise, I walk, I swim, I yoga, I do all that stuff. And that puts your head in a really better place. And your head is super important. I don't know if people emphasize that enough. But it does really aid the healing. I think it's an asset to healing. So how do you become resilient? You just take it one step at a time. I try to be very present moment. And like you said, your sister enjoyed the life that she had. She still was working. She was speaking. She was using her skiing skills, her talent in that arena, and trying to maintain a lifestyle so that you're not 100% patient 24/7, because that will get you so down in the dumps. And so, just like I said, doing what makes you feel good in a lot of ways, emotionally and physically. And, like I said, step by step, day by day, and keep hanging in there.
It's amazing to me that you raised that point about, the mental aspect, the emotional resilience side of things, because I think, I come from an angle of mind-body connection, and that it's all, it all has to work together. I guess in terms of that aspect of it, and coming back to your book, it says here it's an essential roadmap for people, especially for those who have a new diagnosis as well. Tell us about the combination and how you got to that understanding of you yourself needing to have both the physical and the mental and the emotional connection to making sure that you were healthy and vibrant and being able to survive what you had to go through there. Tell us about the journey that you went through to come to that realization that it was a combined effort between the head, heart, and body.
Cindy, I just think it was something intuitive to me. I just realized that the better shape you are in emotionally, the more, what can I say, what's the right word? The possibilities are greater for you. So if you stay positive, if you realize that, like one of the chapters in the book is called keeping your head together any way you can, especially when it gets difficult physically and it challenges your resilience and challenges everything you think you know about yourself. It's a journey. And how did I come there? That's a really good question. I'm not sure I have the answer to that. All I know is I was raised by parents who were very much advocates of advocating and trusting yourself. And that was just a philosophy, that I grew up with. And I just learned more and more that becoming a patient is difficult in every way that you possibly can think of. But the more you try to, like I said, stay in shape, keep your head together, meditate, exercise, hang out with friends. I always say, too, sometimes you feel so depressed you want to have a pint of ice cream. That's okay to do sometimes, too, if it gets you to a little more level area, more stable, so that you feel, you can just move ahead. But I really think it was, my upbringing and my parents always going forward, moving ahead, taking it all a day at a time. And I just hope that people realize how important it is to have an attitude that it's all for today. And all anybody has is for today. So you might as well make the best of it and enjoy it and keep on keeping on.
Going through what you've been through, I think that all of us that have gone through our own personal challenges that are, obviously life-threatening, you come out the other side with an understanding or a new perspective about the meaning of life. What has been your understanding of the meaning of life as a result of your own personal journey?
Well, if you can be helpful to other people, if my journey makes someone else's journey a little easier, then I'm happy to do that. I truly am, because, I think in this whole world we are dependent on each other, and to support and to love one another and to understand that everybody's journey is different, be it a physical journey, an emotional journey, it couldn't be anything where you find that your life is very challenging for presently, at the time. So to offer the support to others based on what you have been through, and that brings other people to a better place. That's, that would be a great goal. And I just hope that the book and some of the speaking opportunities will be useful and meaningful. More than anything, meaningful to people, that they can see that their journey is difficult and challenging, but that others have taken a similar path and moved through it. So
I think that's a really big key, isn't it? Is for us all to know that we're not alone. Because I think that when we, especially, if somebody does get a new diagnosis, it's a very solitary journey in terms of reaching that place of resilience where, you can go, okay, I'm ready for everything that's coming. From the time of diagnosis to that that place where you say, okay, I'm ready for the journey. That in and of itself is a really big leap. And I think that most people feel very isolated and very alone and very, as much as people want to rally around and be supportive, it's still an individual journey. You can have people walk beside you, but you're still the one who has to go through it. Tell us about the steps that you have in your book that guide people through those initial phases. Tell us about what you've included in there so that our listeners can either, look to see that this is going to be a resource for themselves or for somebody that they know and love.
Well, what I talk about in the book too, and I hope people will access it, are support groups, because mostly every serious illness has a foundation and a support organization, and that organization can offer really or takes away, I should say, the feeling of isolation of, oh my gosh, I'm the only one going through this, and how could anybody possibly understand what I'm going through? And so there are, I do mention that in the book, that there are groups that you can meet with wherever you live locally, and there are, like I said, that others are going through this very same problem that you've had. So it's very important to seek those out. I mean, initially, I really wasn't ready to do that because I thought, I don't know, do I want to hear everybody else's problems? But the truth is, there you can get lots of useful tips from other patients that will not be provided by doctors, because they'll give you the medical. That's true. But then you'll hear from a patient who will say, I had this acupuncture and that so helped my neuropathy, or so helped whatever problem I was, dealing with. So I think that is very important for people. And also to know that since treatment is expensive, there is financial aid out there that you can also seek from these support organizations. All you have to do really is to Google your illness. You put it in, and then like the American Cancer Society, the National Psoriasis Foundation, I'm just thinking off the top of my head, but there are all kinds of organizations that will provide you with support and information that you need. That is really useful. Nurses, talk with nurses. They're another great resource. Pharmacists, they will all keep yourself open so that the more information, the more knowledge you can get about your illness and the more support you can get, you'll find that it's doable, as I like to say. It's not what you would choose to do, but it is doable. So it's in there about seeking, information from other healthcare professionals and to other patients, and keeping yourself emotionally as well as you can.
I agree with you about the support group. I saw a quote recently, and it was something about it was to the doctor, don't tell me about my disease that I've lived with for the last whatever years with your 1 month of study. So I guess that's what your whole thing is, just trusting a little bit, and then finding and even helping them, because you often find that is somebody who has lived through a disease, the doctor is taught by that person. And as you said, those support groups, they usually got thousands of people that have been through the issue, and they have some wonderful tips. I often find that, they really know, how to help. So what a great tip.
Yeah, well, you have to be, ready for it. Like I said, initially I wasn't. I stayed away a little while, and then I thought, you know what? I need to open my head, and I need to open my heart, and to listen and to hear what other people are going through and what they have done to help themselves, but also to really support them, because we're all on the journey. And, in my case, it's cancer, but there are a lot of journeys out there that folks are now on. Not anything that they've done. It's just the way kind of life happens. And so if you can find support for you, and also you can provide it for other people, no matter what they're going through, I think it's beneficial to both, because if you feel that you've helped someone, there is some pleasure, if that's the right word. There is some justification. There is some feeling good that you've done something worthwhile. And so, it goes both ways.
Yeah. I know for my sister, she isolated herself completely. She she asked all her friends not to contact her. Mm-hmm. She told them that she had a disease and they were not to contact her, and if she needed them, she'd call them, because what she hated the most was the sympathy looks that she'd get, because she looked terrible. I can say that now, but she didn't look good. And I often wonder, if she had gone the way you did, Reina, I wonder, like, I was her lifeline. When she died and I looked at her telephone bill, because I was there to get, to cancel everything, and I looked at her telephone bill and all the phone calls were to me. Yeah.
Yeah. Well, you were her support. Not everybody wants to go to a support group. Yeah. Sometimes if they find a friend or a family member that provides the support, then that's what they need, and we're all different. There's a million different ways. For me, like I said, I do like the support groups, and it took a while for me to do that. I can tell you, too, that when I was working as a representative, we used to do this program called Look Good, Feel Good. And we would hire a makeup artist and a hairdresser, and the ladies this was with breast cancer, but it could be any. When you feel like you look lousy and you physically feel lousy, then it's like the double whammy. So if you can, bring some patients together and have some professionals spend a couple of hours making them feel better about themselves, because they're looking far better than they did before they, came into like this makeup and hairdressing session, it helps. It lifts your spirits a little bit. And that's, like I said, that's all part of this emotional resilience, to say, okay, you know what? I'm still me. I haven't lost me. I'm still there. And, temporarily, I'm maybe not my best me, but I'm okay. And this is me. And that's why when I would go to treatment, I would always have a little makeup on, make sure my hair was neat and combed, and, wear something that was comfortable, but not sloppy and awful looking, because I do think that cheers you up. It does cheer you up. The look good, feel good is a real concept and a meaningful concept. So I think it helps.
Kim would have loved to have heard that. She's very much, her book is the art of self-care. And no matter what stage of your life, it's so important to, really look after yourself and have that self-care. It sounds like your book has a myriad of amazing tips and things for people to do. It sounds like you have really thought about everything. Is there anything that we haven't talked about that you would like to talk about, or we haven't asked the right question that you would like to share with our audience?
Well, let's see. I do think that what I worked on in the book, too, is asking. That's the biggest little word that I can use, that everybody needs to use when they are in a healthcare situation. And so it's all about asking for what you need, writing down a ton of questions. Keep writing about the treatment choices. Are there other options for you? Ask questions about research. Ask for second opinions. If you're not comfortable with this healthcare professional for any reason, whether you don't feel the emotional comfort, where you're not sure that this treatment is what you want, or you think that might be best for you. And ask yourself too, like I always say, what you are willing to do to get well. Maybe you don't have, an illness that is putting you to bed, all the time, but you have some really disabling discomfort. Are you willing to have surgery? Or you're not? And so really give some thought as to what you are willing to do to get better. So I'm all about asking. That is the biggest point of the book, because the more you ask, the more reliable data that you can accrue, the more knowledge you get, the more often then you are able to have a discussion. As my friend always says, I'm going to my physician as a consultant. They are the people who will give me the expertise of their medical advice, but I also want to make sure that I am very involved in my own care with knowing my own body and asking everything that I possibly can till I get to the place where I feel this is going to be right for me. This is going to be the best that's available for me. And then like they always say, you step into it one step at a time. But do realize that if things are not going the way you hoped they would, then there are other possibilities. You can make changes. You are not committed forever and ever to a certain path that's not working for you. So ask. Keep asking everybody until you're annoying them. But make sure you do, so that you have the comfort and the resilience to keep on going.
I like that. I think that's wonderful. Ask lots of questions. And I guess one of the things I did write down that you said, you even question what you're doing. And so you would just then, if you are questioning it, then you would ask.
Always ask. And people, what I have found writing this book and just talking to people in general, people are very intimidated with a healthcare provider. And it's really not necessary, because most of us have not been to medical school. We haven't had that education. But on the other hand, we do have some smarts. We do have a brain. And so give yourself a little confidence, and don't feel that you can't ask. Don't feel it's silly. Don't feel that it's unnecessary. If you don't understand what is being said, the medical term, the medication, whatever it is, whatever directions are being given to you, make sure you understand it totally, and keep asking until you do. Really, that's essential, absolutely essential.
In Australia, there's it's a social medical system, so it's free for the public. So our doctors are basically, usually you go in there and you just pass them your card that says you're an Australian citizen, and it's all tax funded. And you only get 12 minutes.
Okay.
So when that's happening, it's really hard to ask those questions.
Mm-hmm. It's very hard. That's why I really feel the more preparation you can do before the visit, so that you know exactly what to ask. I know you can't know everything, because you don't always know what's coming up, and you may not have all the knowledge, but you do know what's going on with your body. You want to know what is the most current treatment that would be available to you, what would be the side effects, what would a lot of the prep is what allows you to make the best use of that 12 minutes. So even in the States, where I go for treatment, it depends on the practice and the physician. Some will allow you more time, some not. I go to someone who is outside of oncology in a totally different position. His 10 minutes, he gives you 10 minutes. Well, I said, and I did say, I really don't think that within 10 minutes you can do a really accurate assessment of what's going on with me. because I need to express my concerns, my doubts. But that's the way it is now. So preparing really makes a difference.
Preparation. I love that you've actually, said that. And it is about being prepared when we go to our doctors. And but you're right, 10 minutes isn't a lot of time. We have integrative doctors here in Australia also, and they will charge, but they will give you an hour. And I find that, it's about, do you have the finances in order to afford somebody like that? Or you listen to information or read books like yours, Reina.
Well, combination. I know when we lived in a part of North Carolina, there was a wonderful integrative medicine facility, and even the building itself and the grounds. As soon as you went there, you felt better. Honest to goodness, it's amazing. But it was quite expensive, and something that I couldn't afford to do at the time. But I think if there's any way that you can, it is very, what can I say? What's the right word? It's healing. It's healing to be allowed to say what you need to say, ask the questions, feel that you have the time, to really discuss whatever is on your mind. And I just think it would be great if it's possible for people to do that. There are in the States, now, I don't know about Australia, but there are foundations that will help you financially. They will help you pay for the medication. You get a grant. And then there are, foundations that might help you pay for your health insurance. So depending on what they have in Australia, I wonder if there are foundations there that will do the same for you, that will provide some funding. Are there any like that?
Most definitely. And some of them are in our community. Like we have a beautiful one in our community called Bloomfield. And it's all about, it's cancer. And they started in a small room in a little, home in the middle of the Sunshine Coast where we live. And now they have stores everywhere where people donate products for them to sell. They then in turn help all the people in our local area with cancer. So that's just one that I know of. So we're very fortunate. We also have a scheme in Australia called the PBS scheme, and that is the government pays for your prescriptions if they're on the scheme. Yeah, I go to America and I see your insurance system and your healthcare system and how expensive it is. If you came to Australia, you'd go, wow, this is kind of cool.
It is. It's very cool. Well, I remember when we lived in the UK for a little while, and then you would go what they used to call to the surgery, to the doctor's office, and that was their national healthcare system. But then if you wanted to and you could afford it, you could then go to a private provider and get more time, and so forth. And so, it really depended on your finances. Here it's tough. It is tougher, but there is help. And that's all about asking. People don't even know that it's available. And sometimes the doctors are in a hurry, like you said, 12 minutes. Yeah, wherever you are, in the U.S. or in Australia or anywhere, time is limited unless you have a lot of money. But that being said, there are ways to get some money to help pay for the medication. And, you have to provide some information so that they know that you would be eligible for help, financial help. But many people are. And if you can get that, then wonderful. So like I said, help you pay for insurance, help you to sometimes prescription drugs, depending on the type of plan that you have. So there is support and help out there, but you got to ask. You must ask so that you learn. I read a book when I first started treatment. I didn't even know where all this stuff was. But there was another patient talking about support who wrote all about where to go for financial aid. And that book cost me $10, and I have to tell you, that was the best $10 that I ever spent.
That's pretty good.
Amazing.
Mm-hmm.
Reina, this has been an amazing podcast, and unfortunately we're out of time, but it's been spectacular to have this conversation with you. Where can our listeners find your book? What's the best way for them to track you down and follow what you're doing?
Well, the book is available on Amazon. So if anybody would like it, there it is. Trust your doctor, but not that much. And then I have a website, reinaweiner.com. So there are recordings of interviews like this one, some TV interviews, and blog, and so forth. So that is reinaweiner.com, REINAWEINER.com. That's me.
Awesome.
I'll make sure it's in the show notes so that everybody can find you very easily.
Thank you. Appreciate it.
Amazing. Reina, thank you so much for being a part of today's show and for sharing your wisdom and your experience and your advice for our listeners. You've been an absolute joy and blissful to listen to. So thank you so much for going through this on behalf of humanity and then for coming out the other side and sharing your experiences and knowledge.
Oh, you're too kind. Thank you so much. I so appreciate your inviting me to the show. Thank you so much.
Thank you so much. And for all of our listeners, to find out more about Reina, to follow her, go to the show notes and you can find everything that you need at allthews.facebook.com/up-for-a-chat. Or you can also go to allthews.thewellnesscouch.com/up-for-a-chat. Most importantly, join us here next week on Up for a Chat, where you get to become part of the ripple effect that's changing the world. We're going to see you on the ride. Bye for now, everybody.
This has been a production of TheWellnessCouch.com. Check us out on Facebook and join in the conversation on Facebook.com/TheWellnessCouch. Subscribe to each show on iTunes and check us out on Twitter. The Wellness Couch, streaming wellness into your lives. Whilst the Wellness Couch presenter endeavor to provide accurate and helpful information to their listeners, these podcasts cannot take into account individual circumstances and are not intended to be a substitute for health and medical advice from a qualified health professional. You should always seek the advice of a qualified health professional before acting on any of the information provided by any of the Wellness Couch podcasts.